We're going to carry on with your VNO4 unit today. So just before we start, just to go through the safety checks. Please can everybody make sure that their laptop or tablet or computer or device is plugged in or charged up to full. If you've got any technical issues, remember to message the help desk, but we will have a moderator popping in and out of the lesson as well that I can also ask for any help on things. Sharon, that's absolutely fine. When you leave the lesson, either completely leave the classroom altogether or put your status on away so that I know you're gone, and just make sure you catch up with the lesson within the week so that your attendance is tracked. Just to remind you all that the lessons are recorded. You should all be aware of that by now. But just to reiterate that the recordings include anything written on the public chat, anyone's microphones if you turn your microphones on, and anyone's webcams if you turn your webcams on. If you want to say anything that you don't want putting in the recording, then pop a message to me via the private chat, and remember the breakout rooms aren't recorded. Just because the breakout rooms aren't recorded does not mean that I won't be monitoring them for use of inappropriate language or any inappropriate conversations, so just be mindful of that. Obviously remember, even though we're not actually in a classroom, this is a classroom environment, so we need to respect each other, respect our British values. Just as I've mentioned before, please use the public chat mindfully. If you want to speak, I know you guys are happy to use your microphones to speak, which is great. More the merrier, I don't have a problem with that. Or just pop a message into the public chat box. There'll be loads of opportunities to ask questions throughout the session. There'll also be poll questions and other areas where we can all interact with each other as well. If you've got any questions, like I said, just if you turn your microphone on, I usually can tell when you've turned your microphone on anyway to speak. A little notification pops up at the top of the screen, or just use the public chat. And if anybody has any concerns, any safeguarding concerns about yourself or another member of the class, remember you can always speak to the safeguarding team. You can email the generic safeguarding email address, which is just here, or ring the safeguarding contact number, or you can privately email any of the safeguarding team members. Doesn't matter which centre you're affiliated with, you can speak to anyone there. It's really important that we all look out for each other, especially while we're all at home, potentially going through different levels of stress. Okay, so bearing that in mind, we're going to start with our lesson. So today we're going to look at preparing and dispensing medications. When we're in practice, we're going to look at the health and safety implications of this and the sorts of the do's and the don'ts. So by the end of this lesson, we should all be able to state how we prepare and dispense different medications, including oral preparations, topical, parenteral, and rectal. We should be able to describe how to ensure the safe handling of pharmaceuticals, and we should be able to state how to dispose of any excess medication or any contaminated equipment correctly and safely. Hopefully, some of you might also then be able to analyse the methods that you use in practice for storage and dispensing medication, and then evaluate that. Is this done in your practice to gold standard? Is there anything that could be changed that means that you could improve this service that you offer? Is there anything that you could do through do you know, this always happens, doesn't it? It's not even a difficult word. An audit. Is there anything that you could think about maybe doing a clinical audit with? And putting some potential changes in place to improve your practice. It's Monday. Okay, we're going to start off with a little task on the breakout rooms. Oh, Shauna, honestly, it doesn't matter what day of the week it is, to be honest, it happens regardless. It's never difficult words, it's always really simple words. I'm going to start off with the breakout room. You're all really comfortable using breakout rooms by now, I know, but just make sure that when you enter the breakout room, you don't close off the main session tab, and when you leave the breakout room and come back into the main room, you enter with your microphone or with your listening mode, otherwise you won't be able to hear the lesson. So what I want you to think about is the regulations that are involved with when handling medication in veterinary practice. There's loads of different regulations that you need to follow. You should have already learnt about these and done some work on these on your online learning, but I want you to have a think about what they are. Can you think of as many different legal acts that are involved with the handling of pharmaceuticals? I'm going to give you about 15 minutes to do this. Try and get down as many as you can think of. There are quite a few. If you manage to think of as many as you possibly can, you can use the internet, you can use the BLE, you can use textbooks to help you research. Try and get as many as you can, first of all, just from your own previous knowledge. But if you've still got a little bit of time left after that, think about what these acts actually do. So rather than just naming as many acts as you possibly can, think about what those acts themselves actually control or regulate and jot some notes down. So there is 23 of you. So we'll go into 5 breakout rooms. You've got some decent sized groups. Okay, so hopefully you should all get a notification soon to enter a breakout room. See most of you are going in there already, but I'll just pause the lesson. Okay, so I was popping in and out of your breakout rooms, and I saw that pretty much everybody was getting some really good ideas. You've really done well on that. You've thought well about what different regulations are involved. Had some really good ones put down. I've just added a couple to this page. So some of you had different ones to what I've got. Most of you had at least some of these. Some of you also had things like COSH and Health and Safety at Work Act, which are very relevant. But I just thought I'd pop these on as well, just for a little side note for you all to consider. So if there are any on here that you have not thought about, might be worth just jotting them down, and then you can have a quick look over them and make sure you're aware of what these acts do. So I'll just leave that a second so that you all have a chance to just write any notes that you need to. So moving on from regulations, so that was just a little bit of a check for me to see how much you already knew about the regulations, see if there's anything that we do need to go over. But you were all getting some really good discussions on those going through, so I think we're all right for regulations. So well done, everybody. So we're going to move on now to health and safety, which is really paramount when we're talking about veterinary medicine and handling and preparing veterinary medicine. So there's loads of health and safety concerns when we're dispensing medicine. So just to start us off, Ryan, can you think of a health and safety concern when we're dispensing medication? Just think of one, just pop it either into the public chat, or if you want to turn your microphone on, then that's absolutely fine. What things do we need to worry about?
So accidental self-administration, whether it's, powder off of tablets can get on your hands or on your gloves, and then you touch your face.
Yeah, perfect, brilliant, yeah. So not just touching your face, some drugs are absorbed through the skin as well, remember? So it's really important that we need to be wearing our PPE at all times when we are handling our medication. Anyone think of anything else? Sharon, can you think of one? Anything?
was thinking more, we put the disposal of them. Essentially, like we have diabetic patients who use the syringes with the needle, and you have to provide them with a sharp box.
Brilliant. Yeah, definitely. Especially diabetes and patients with diabetes. They're going to be administering their medication via injection. So you need to make sure that you're administering the clients with the correct equipment to be able to do this, and that you're training them properly as well on it. So does anybody work in a practice where you don't do diabetic consultations? So when the patient first gets diagnosed with diabetes, does anybody not do like a really long-winded consultation where you show them how to inject the patient, what to do with the needles afterwards, things like that? Does anybody do anything different than a consultation? Have any of you been in those consultations? I know you're all sort of, some of you won't have been in practice that long, never seen a patient. Yeah, I was going to say, have any of you actually seen the consultations? Oh, of course, yeah, some of you still won't have been able to get in, will you, with everything that's going on? Okay, diabetes, it can be a really daunting thing for a new pet owner to have to deal with, because not only are they being told that their pet has got a chronic lifelong illness that might reduce their life expectancy, but it's a massive commitment to take on. They're going to have to inject the pet twice a day. They're going to have to completely change their whole routine around that pet, because it's not just about giving insulin as a diabetes. You need to have you have to have a very specific structured life. If you have a pet with diabetes, they have to have their insulin at exactly the right time of day. They have to be fed at exactly the same time of day. They even have to have the same type of exercise every day. So I have a dog in our family, and he tends to go for multiple shorter walks midweek. So he'll go out maybe 3-4 times during the week, 20 minutes during the day, during the week, 20 minutes at a time maybe, for a good run, throw a ball for him, get some energy off him. And we always try and make an effort on a Saturday or Sunday to go for a really long family walk, unless it is hammering down because he doesn't like rain. He refuses to find point to go out if it's raining. And I know a lot of families aren't like that. They like to utilise the weekend quite well, and they like to go off, go somewhere nice, maybe go to the beach, or go somewhere where there's a really nice local walk, go out for a good hour or so with the dogs. If you've got a diabetic pet, you can't do that. Your pet has to have the same type of exercise every single day, because otherwise they're going to start to use more of their blood glucose, and they're going to metabolise it quicker through exercise. I know it is. I mean, they get used to it after a while. Most diabetic pets, if their diabetes is managed properly, live a really nice, happy, fulfilled life. But the shock of that for the owner to come to terms with is a massive thing. You're going to have to really, you're going to have to rethink potentially family holidays, weekends away, who you're going to trust to look after your dog or your cat. Because cats get diabetes too. Especially cats, is it an outdoor cat? How on earth are you going to control diabetes in an outdoor cat? So there's loads of things to consider. And then you've also got that added concern of the fact that they're going to have to inject their pet twice a day, every day, for the rest of their pet's life with medication. And now for you guys who've been in practice, you'll know when you first started in practice, when somebody first asked you to give an injection, whether it was cutaneous or intramuscular, it is a daunting prospect, a daunting thought. So imagine that for the owners who have had absolutely no medical training potentially. So it's a really big thing that we have to be very aware of, and we have to give really thorough training to our clients. So a couple of things that I used to do when I was in practice, if I was doing a diabetic consult, which veterinary nurses are absolutely allowed to do. by the way, is totally within our role of remit to do diabetic consults and to show the client how to administer the medication. We just can't alter the dosage of the insulin. But I used to actually clip off the fur at the back of the pet's neck. So clip a little patch about so big just at the back of the pet's neck, especially if you've got a really fluffy dog like a husky, let's just say. It's much easier for the client to see the skin that they're injecting into so that they know that they're not missing. Yeah, it used to really help a lot of them. And then I used to have a little squashy dog, like he was made of foam, that I used to have them practice injecting air into. So I used to get them to practice getting a skin tent and then injecting, and then putting the syringe into the sharps bin. I used to use a little bottle of water for injection for them to practice drawing up the solution. And I used to take a good half an hour with these clients, going through step by step. There's loads and loads of things that you can also give to help. So there's DVDs that Can Insulin, one of the makers of insulin, do. There's diaries that you can give out to the owner, again, that Can Insulin have created, where they can monitor and record the patient's urination. Yeah, definitely. Yeah, the vet pen, there's much less room for error with your vet pen. Jay, can I ask this? Yeah, so you give your insulin subcutaneously for diabetes. Any other health concerns? So I sort of went a little bit off topic there when we were talking about diabetes. But can anyone think of any other health concerns? Allergies, yes, well done. That's a good one I was thinking of. Yeah, David, Fiona, brilliant, well done. Yeah, allergies. You need to be asking the owners, is anyone got any known allergies in the practice? If you, let's just say, for example, dispense penicillin to someone and their child is at home with penicillin allergy, you could potentially kill that child. As a veterinary nurse, as a registered veterinary nurse, you would be completely liable for that. Okay, we are responsible for our own actions. We're a regulated profession now. That would be a really gross misconduct and negligence on your behalf. So you've got to be so aware of these things. So moving away from allergies ever so slightly, and think about maybe a specific gender. Pregnancy, yes, brilliant, yeah, it's all coming through, yeah. Certain drugs are what we call tetragenic. Please don't ask me to spell that. Does anybody know of one in particular that we might dispense to cats? More common than dogs anyway. Carbimazole. Yep, brilliant, Vicky. Yes. So, Vicky, can you tell us, for those people that aren't in practice, can you tell us what carbimazole is, what it does, what we use it to treat? Yes, perfect. Really good. That's a really good description. Yeah, absolutely. Oh, I wasn't expecting you to get too in depth with it. Absolutely. Carbimazole. We also have there's one called Vidalta. There's one called Belimazole. Those are the three that I know of, and they treat patients with a hyperactive thyroid, which are usually adult cats. They get really, really skinny, really greasy fur. They're ravenously hungry, but they never put weight on, and it's because their thyroid gland is overactive. So we treat that with medication. But the medication for an overactive thyroid is tetragenic. So, Ryan, you said the word tetragenic. Well, you spelled tetragenic. Thank you very much. teratogenic is? Can you explain?
I would assume it's basically it causes some form of deformity or harm to any fetuses.
Yes, yeah, absolutely, yeah. It damages the fetus, so it can cause abortion in pregnant women. So I know it is a bit of a faux pas and developmental malformation. Yeah, brilliant, Ryan, well done. It is a bit of a faux pas to assume someone is pregnant, especially if they might not be. But when you are dispensing these particular medications, it is really important, maybe not to direct that question directly at the female owner who is collecting the medication, because she might get a little bit offended if she's not, but just to say, is anybody in the household pregnant? Maybe making a little bit more of a broader context. Again, with the male, if there's a male collecting the medication, anything like that, just make sure that there isn't anybody who is pregnant in the house, and if so, we should be dispensing gloves or advising that you wear gloves. As someone who has been asked if she's pregnant when I'm not, it's not the best ego booster, but it is really important that we do ask these questions when we're dispensing certain medication. David. It's a bit of a tricky one because I can completely see where you're coming with that. But say, for example, the owner had rang up to order the prescription over the phone, and then the receptionist had then gone to the veterinary surgeon and said, oh, you know, this owner wants this. The veterinary surgeon had then checked the prescription on the system and gone through all the correct checks, and you were the person who was having that second contact with the owner, and you didn't advise of any warnings, then you could still be liable. It should state it on the medication label. If in doubt, just cover your back, okay? And usually, most of the time in practice, if a specific medication has any genuine side effects, things like, you know, it's tetragenic or something like that, or it contains penicillin, it usually will say it on the drug label. Your practice will usually have that label that is automatically printed on the label anyway, but it's always worth giving a good scan over and just being aware of being on the safe side. A lot of the time as well, if a client has a known allergy, there'll probably be a note on their card, on their client history as well, just to warn everybody about that. But it's always worth having a quick scan of the drug, the data sheet, just to be on the safe side. Okay, so there's loads of different safety concerns when we're dispensing medication. But what if we dispense it into the wrong container? What could happen if we dispense medication into the wrong container? Alice, what do you think? Oh, good word, Ryan. Denatured, yes, I like it. Yeah, perfect. So basically explain what Ryan has just said. So there's a lot of medication that needs to be kept away from direct light. So we've got light-proof containers that they're put in. If that isn't done, then it can be denatured. It can stop working. Yeah, you can medicate the wrong pet. Absolutely, David. Oh, yeah, good one, customer. Yeah, contamination. If you don't store it properly, it could get contaminated by something else. So it could get wet. Again, it could be exposed to sunlight or extreme temperatures. Okay, does anybody know heat? Yeah, absolutely. Quick change of status. Who has been in practice? Thumbs up if you have, thumbs down if you haven't. It is a bit more of an old-fashioned question, so even if you're in practice, you might not know the answer, but we'll just have a quick see. Fiona, if I was to say a fluted glass bottle, which would look, let me draw it. This is my floor drawing of a glass bottle. And the fluted bit are these ridged lines going along it. So if I was to say, put this medication into a fluted glass bottle, do you have any idea why I might say that? What is that medication for? It's fine if you don't. No, that's fine. Could anybody think what a fluted glass bottle could be used for? They're not used as often at the moment, like nowadays in practice. But it's something to be aware of. It's not that it would damage a plastic bottle, and as far as I'm aware, you might be able to get fluted plastic bottles. I'm not sure. I've only ever seen glass ones. Okay. I'll just wait for Sharon. Oh yes, brilliant, Sharon. Yes, absolutely, it is. So owners that have a disability that affects their vision, so potentially blind owners. Right. So Sharon, you've said that it could be for owners with difficulty with vision. So we would dispense a certain type of medication into a fluted glass bottle for owners with visual difficulties. Jenny, what do you think? What would we potentially put in that bottle? We would potentially put ear and eye medications. Be less specific. Amy, what do you think? If we're being less specific, it is a liquid. Be more specific. What kind of liquid? So think about, Jenny's just said ear and eye medications. So we're going slightly less specific than for a certain area and more of a certain type of medication. Not antibiotics. Not oral. Opposite of what Shauna's thinking. It's not an oral medication. Comments coming through. Vicky, what do you think? External use. Yes, absolutely. Medication, well done, Vicky, for external use should be dispensed into a fluted bottle. Okay, so that if you have a client that has got a visual disability, they're not going to give their dog a bottle of shampoo as oral medication, basically. They're not going to feed their patient a medication that's not for oral use. So if we put it into the wrong container, basically, long story short, if we put things into the wrong container, we could also cause owners to use the medication wrong. Nobody wants to eat shampoo.